Welcome to today's lecture on the histology of the gallbladder and its associated structures. In this session, we will explore the intricate world of gallstone formation, gallbladder pathology, biliary tree anatomy, gallbladder imaging techniques, cholecystectomy, bile composition and functions, bilirubin metabolism and jaundice, cholecystokinin, CCK, and gallbladder contraction, gallbladder carcinoma, gallbladder motility disorders, gallbladder embryology, and gallbladder neuroanatomy. By the end of this lecture, you will have a comprehensive understanding of the histological aspects and clinical implications of these topics. So without further ado, let's dive right in. Gallstone formation is a pathological condition characterized by the development of solid particles within the gallbladder or biliary tree. These particles, called gallstones, can vary in size and composition, mainly consisting of cholesterol, bilirubin, and calcium salts. The precipitation of these components results from an imbalance in bile composition, which may be influenced by factors such as genetics, diet, and hormonal changes. The presence of gallstones can lead to various complications, including biliary colic, acute cholecystitis, and cholelithiasis. The gallbladder is susceptible to several pathological conditions, including acute and chronic inflammation, known as cholecystitis. Acute cholecystitis is often caused by the obstruction of the cystic duct, usually by gallstones, leading to gallbladder distension and subsequent ischemia. Chronic cholecystitis, on the other hand, is characterized by long-standing inflammation, thickening of the gallbladder wall, and fibrosis. These pathological changes can significantly impair the gallbladder's function and may necessitate surgical interventions such as cholecystectomy. The biliary tree is a complex network of ducts responsible for the transport of bile from the liver to the gallbladder and ultimately to the duodenum. It consists of the intrahepatic bile ducts, which collect bile from the liver lobules, and the extrahepatic bile ducts, including the common hepatic duct, cystic duct, and common bile duct. The precise arrangement and branching patterns of these ducts are essential for the efficient flow of bile and the prevention of bile stasis. Various imaging techniques are employed to visualize the gallbladder and detect any abnormalities. Ultrasound is commonly used as an initial diagnostic modality due to its non-invasiveness and high sensitivity in detecting gallstones. Additional imaging modalities such as computed tomography, CT, scans, magnetic resonance imaging, MRI, and hepatobiliary scintigraphy, HETA scan, may be utilized for further characterization of gallbladder pathology, assessment of biliary tree anatomy, and evaluation of gallbladder motility. Cholecystectomy refers to the surgical removal of the gallbladder and is considered the definitive treatment for gallbladder pathology, especially in cases of cholecystitis and gallstones. The procedure can be performed using laparoscopic or open techniques, with laparoscopic cholecystectomy being the preferred approach due to its lower morbidity, shorter hospitalization, and faster recovery. During the surgery, careful attention must be paid to the biliary tree anatomy to avoid any inadvertent injury to the common bile duct. Bile, produced by hepatocytes within the liver, plays a crucial role in digestion and absorption of dietary fats. It contains various components, including bile salts, cholesterol, phospholipids, bilirubin, and water. Bile salts, synthesized from cholesterol, aid in the emulsification of fats and facilitate their digestion by pancreatic enzymes. Additionally, bile serves as a vehicle for the elimination of waste products, such as bilirubin and cholesterol, from the body. Bilirubin is a yellow pigment derived from the breakdown of heme, primarily from senescent red blood cells. It is transported to the liver, conjugated with glucuronic acid, and excreted in bile. Any disruption in bilirubin metabolism or bile flow can result in the accumulation of bilirubin, leading to jaundice, a condition characterized by yellowing of the skin and mucous membranes. Jaundice can be indicative of various underlying pathologies, including liver disease, biliary obstruction, or hemolytic disorders. Cholecystokinin, CCK, is a hormone released by the enteroendocrine cells of the duodenum in response to the ingestion of fatty foods. It acts on the gallbladder, causing its contraction and the subsequent expulsion of bile into the biliary tree. This process is crucial for the digestion and absorption of dietary fats. The contraction of the gallbladder is coordinated by both nerves and hormones, ensuring efficient delivery of bile when needed. Gallbladder carcinoma is a malignant tumor arising from the epithelial cells lining the gallbladder. It is a relatively rare but aggressive malignancy, often diagnosed at advanced stages due to its nonspecific symptoms. Risk factors for gallbladder carcinoma include gallstones, chronic cholecystitis, gallbladder polyps, and certain genetic conditions. Early detection and surgical intervention offer the best chances for successful treatment and improved patient outcomes. Gallbladder motility disorders refer to abnormalities in the contraction and relaxation patterns of the gallbladder. These disorders can manifest as gallbladder dyskinesia, characterized by impaired gallbladder emptying, or as gallbladder hypercontractility, leading to increased gallbladder motility. These conditions can result in biliary colic, functional biliary obstruction, or recurrent cholecystitis. Diagnosis is often challenging and requires a combination of clinical evaluation, imaging studies, and specialized functional tests. The gallbladder develops from the foregut endoderm during embryogenesis. It arises as an outgrowth from the primitive bile duct, which eventually forms the cystic duct and gallbladder. The gallbladder undergoes complex morphological changes, including enlargement, folding, and rotation, to assume its final position in the right upper quadrant of the abdomen. Understanding the developmental origins of the gallbladder is crucial for comprehending its anatomy and identifying congenital anomalies. The gallbladder receives innervation from both the autonomic nervous system and sensory fibers. Parasympathetic innervation, mainly provided by the vagus nerve, promotes gallbladder contraction, while sympathetic innervation, derived from the celiac ganglia, inhibits its activity. Additionally, sensory fibers transmit pain sensations from the gallbladder, contributing to the perception of biliary colic. An understanding of the gallbladder's neuroanatomy is crucial for comprehending its physiological and pathological responses. In summary, an in-depth understanding of the histology of the gallbladder and related structures is crucial for its proper function and management of disorders. Medical students need to grasp various aspects, from gallstone formation to neuroanatomy, to effectively diagnose and treat gallbladder conditions.